Welcome to our latest episode of the Lebanese Physicians Podcast. And today, actually, we will be discussing the mental health journey and how AI and digitalization is actually transforming mental health. And our guest today is Srishti Srivastava, who has developed actually a startup company that is currently active in 165 countries. And she is looking at using AI as potentially a screening tool for mental health issues and then referring patients afterwards, psychologists, psychiatrists. Welcome to the podcast.
Thank you so much. It's great being here.
Can you tell us first, as we introduce you to the listeners, can you tell us a bit about your journey and what led you to build an AI mental health companion platform?
Awesome. So I just love this question. So I used to be a national quizzer in India, and I went on this quiz competition called India's Child Genius. And it's a widely telecasted quiz show. And I just, froze on national television at the age of 12. And then I started experiencing stuttering and a lot of social anxiety, essentially. And that's what kickstarted my own therapy journey. But actually, when I navigated that, I found that, it's pretty complex. Like mental health in India, that too in early 2000s, was extremely complex and extremely problematic. You had to wait to find the right therapist. And there was a lot of stigma around mental health in the eastern part of the world. I think you might be aware of that.
Right.
And yeah, like I think therapy was also not extremely affordable. It took you at least 5 matches to find the right therapist. And in my journey, I would have spoken to more than 20 therapists. And I would have, spoken to more than 100 people with mental health issues, through support groups and other channels. And yeah, that's what inspired me to actually solve this problem at a very early age. My solution, of course, initially was more of a wellness solution. Like I wanted to initially do something to relax your nerves. So I toyed with the idea of building like a meditation or a sleep app. I mean, where I come from, meditation is like a massive deal. Yeah, yoga and essentially these modalities are some things that we grow up with. So I wanted to bring that to the world. And over time I realized that it just takes one life challenge, one heartbreak, one loss of a job to really push you over the edge from a person who is relatively healthy or maybe subclinical to somebody who has like clinical symptoms and to somebody who can't possibly meditate or do yoga because they're just so distressed. So I felt like this could be deeper, like we could have a deeper solution. And this is before the whole chat GPT and AI revolution came about. We were anyways building an AI chatbot which could be used as a tool for people to know themselves, right? Which had like some rule-based pathways along with some dynamic components. And interestingly, within like 7 or 8 months of us attempting to build that, we had ChatGPT come out. And then of course, it's a whirlwind after that, right? Like so much happened, and I think the timeline is so super. It just feels very compressed. Like so much really happened in from 2023 to 2025, and we were quick to adapt. We were quick to like integrate generative AI in our flows. And as of now, we are focused on making AI, mental health AI safe, because currently the existing solutions are not very safe. Like there are a lot of concerns around, large language models hallucinating a whole lot, lawsuits, against the makers of these large language models for, abetment of suicide and, AI psychosis. So yeah, that's essentially what we are trying to solve through our product. We're trying to make it safer.
Right, because you mentioned something. This is a new entity now, which is AI-induced psychosis, and people actually are presenting with it. And you hear, I mean, it's like a hearsay, but you've heard like people commit suicide after talking to ChatGPT and stuff like that. So that's
Yeah,
the
yeah, yeah.
concern that's arising at this point. And I know you're where are you based in India, Srishi?
Yes. So we are based in Mumbai, but I spent a whole lot of time in United States. I lived in Boston for 9 months. I was in DC for 3 months.
Nice.
So yeah. So went around navigating and understanding the complexities there as well, right? It's a lot more sorted. United States is privileged to have a relatively more developed mental health ecosystem. But of course, there's challenges around long wait times and just like really expensive and unaffordable options without insurance.
Exactly, because even in the United
Yeah.
States, I think there's still very long wait times to get into mental health
Extremely
specialists.
long. Yeah,
Yeah.
yeah, yeah.
But I agree with you in Eastern countries such as Lebanon or India, it's also a lot of insurance companies do not cover like mental health services.
Yeah, yeah,
That's a big
yeah.
problem because then you're selecting only for the people who can pay to get mental health,
Exactly.
but people who cannot pay end up not getting them.
Exactly, exactly. And without insurance, mental health is practically unaffordable for the majority of Indian population.
Right.
And maybe like as much as 5% of insurance companies cover mental health in some form, and the coverage also is not ideal because highly clinical in approach. So if you have a clinical diagnosis, that's when you can avail them, but not for, issues that you encounter, which are like subclinical or which are like more, I would say, life challenges than clinical conditions.
Because you also studied, just to go as a background for you, you studied technology, right? You were at the Indian Institute of Technology, which actually is a very good university and
It's like
equivalent to, I guess,
MIT.
the MIT in India. Exactly,
Yeah,
exactly.
it's India's MIT.
Yep.
Yeah. We had Sundar Pichai and we had a few other, CEOs from in here. So yeah.
So to summarize, I think what you've done is great because you actually had anxiety, right? Social anxiety or anxiety during speaking and stuff like that, and you were able to actually, instead of being disabled by that, you were able to use that to try to solve a problem for not only yourself but for a lot of people in India and maybe in a lot of other countries too at the same time.
Absolutely. No, I'm sure there's a lot to be covered. Like there's a lot more ground to be covered in my
Right.
journey.
Right.
But it's I think very empowering to solve your own problem, and in that process of self-discovery, you know, inadvertently doing it for a lot of people, you know.
Right. Right.
So, yeah.
And Srishti, what is the name? What's the name of your company and what's the website?
Yes. So our company is Heal Health Tech Private Limited, but the product that we have is actually more known. It's called Healo. So
You
Heal and O, Heal and O.
right.
And yeah, Healo AI is essentially a platform which not just has like AI therapy and AI mental health companion, but it also has like one-on-one sessions with, mental health professionals, psychometric tests, worksheets, and essentially things that you require in your mental health journey, right? You need a whole lot of stuff. You maybe journaling, maybe mood tracking, right? Maybe some short courses. So we try to put that all together, and my understanding is that we are all moving towards, generative AI based solutions and possibly even agentic AI solutions, right, in the
Right.
future. And I think there will come a time when the interface would look different. You would just command our phones that, call my therapist or book a session with a therapist, or like I'm feeling this way. Can you help me out, right? And you want to build for that future, essentially.
Right. So to ask you this, because when we were talking about this, there's a lot of online now mental health services that probably
Yeah.
differ from your platform, like so let's say BetterHelp,
Yes.
or stuff like that. How does your platform differ from these common currently online mental health services?
So I think as a whole, US has done a great job of trying to find solutions to the problems that it faces. But I do think that the next big player in mental health would have AI, simply because the scale that's required and the affordability that is required, right? That can only be done through an AI solution. Not to mention that we are progressively getting more and more, I would say, I think less social as a whole. So it feels like a lot of effort to even like go to a therapist, put on like some better clothes, do up your hair and to actually show up. And I think we're starting to get a lot more impatient with people as a whole. So I find a lot of people, there's a Reddit group called Therapy GPT and a few others, where a lot of people rant about, mental health professionals, even though health professionals are, trying to do their best. So there's a lot of criticism around therapy, and I think it's just as humans we're not attuned to, you know relationally now connect and interact with other humans in such a vulnerable way, right? So AI here can help in the first step, and often it is the first step for a lot of people globally, right? You might hesitate to reach out to a therapist for a variety of reasons, and with this it's just instantaneous and easier, and if you see that it works, you can imagine that if you find the right therapist for your needs, it'll obviously be 10 times better. So our goal is to not replace therapy, but to essentially augment human capacity, essentially to build a system where more people want to talk about mental health and eventually, you know, try our solution and find their way to a therapist that works for them, even as they continue talking to AI, even as they, use AI for day-to-day purpose, like a AI journaling tool of sorts.
Yeah, so basically, even if there's a taboo, right, to reach out to a mental health specialist, talking to AI
Yeah,
first might be a first step to get you
might
towards
be a
talking
first
to a
step.
mental health specialist
Yeah,
afterwards.
yeah, yeah,
Basically, what you say is you have an AI mental health companion, right?
yeah,
So,
yeah,
can you tell us more about what that is and how does it interact with its users? Because let's say I'm somebody who has anxiety or I feel like depressed all the time, and I'm saying, all right, I'm gonna go to Healo and
yeah,
try to find out or talk to AI about my symptoms. So how does
yeah,
it start? Like how do I log on and then how does it start where I talk about
yeah, yeah, yeah.
yeah.
So I think we try to make as frictionless as possible because we understand that a lot of people are neurodivergent and they don't have the patience to log in first and then to explore the product. So you come in here and you pretty much start talking about your problems, right? Whatever you're facing, whatever is on your mind, really. And it's a job of AI to figure out like what do you really need in the moment, right? So I could come in here with like just a bad day at work, a hectic day, not having enough time to eat, which is relatively, I would say, a simpler problem, right? That's where AI would actually understand, guide you, provide some kind of mental health support. And as soon as it senses that perhaps this human needs more, like let's say it escalates and you feel extremely angry, you feel like lashing out at your partner, you sometimes, become so overwhelmed with rage that you want to act out certain impulses, maybe homicidal tendencies. Suppose it escalates that way. At that point in time, when it's extremely high risk, that's where there'll be a human in the loop, an actual human, you rematch to an actual human that you can converse with. And we also have tie-ups with distress helplines that you can connect with. So that's our whole idea behind making mental health safe, like for every spectrum of person, because people don't discern, they just come on a platform, they don't know whether their issue is severe enough, right? So ideally the AI should have some intelligence to gauge that during the conversation itself, right? So that's what we have built. And of course our AI, of course, is, it matches you to humans and it does all of these things. But we think of it also as kind of like an ecosystem of sorts, right? It should be also be able to provide you psychometric tests that you need. It should be able to provide you the worksheets that your therapist might be giving you, right? So it's able to provide for all of those resources that go along with therapy too.
Exactly. So yeah, but how do you ensure? So typically, sometimes I call like in let's say a doctor's office, and I get like first
Yeah.
an AI chatbot or talking to
Yeah.
me, and I feel they're
Yeah.
not very empathetic. How do you
Yes.
ensure that your AI is feeling empathetic rather than
Yes.
robotic, I guess, with the patients?
Absolutely. So I think that was the main case for a specialized model like us. You already have large language models giving their version of quote unquote AI therapy, which is of course problematic, right? We already spoke about AI psychosis, AI psychophancy, which ties in closely, AI trying to please you, not calling you out enough, right? We felt that some of these problems are somewhat systemic, and sure, you can prompt engineer your way out of a few of them, but to truly make it safer, to truly reduce the hallucination rates, it would make sense to train your own models, like fine tune your own models on therapy specific data sets. So that's what we have done here, right? Because you're able to control the data set, consequently the chatbot happens to be more in your control as well, right? And it says things that it should say, and you have less of a problem of it saying like the wrong thing, right? We managed to bring down the rate of hallucinations by a whole lot just by training something that's highly specific, right? And then of course we have a multi-agent system. So for each of these risk personas or risk profiles, starting from the lowest degree of risk of people, trying to just develop themselves, develop insights about their personality, like which is more of a self-development case, to life problems, which where people are actively navigating like life challenges like heartbreak or grief or loss of a job, to something even more severe like a clinical diagnosis and you being in a pretty bad shape, it being like a clinically diagnosable condition, to something which is like, suicidal ideation, homicidal ideation, something that warrants possibly hospitalization or acute care, right? So we cover this entire profile by different agents. So you have a different agent for like one our flow, which is more of a crisis kind of a flow, right? And you have another flow for the milder cases. This ensures that the flow proceeds exactly as it should. If you try to solve it through one agent, you might end up creating, a lot of role conflict, which sometimes leads to more hallucination than it should, right? So like that, we've implemented a whole lot of guardrails, and that's consequently made it, a lot safer. And we've tried to benchmark it with some of the more popular apps in America, in United States, like, Slingshot, Ash by Slingshot, and several others. There's Yana and there's Yuna, and then there are a few others. So you really try to benchmark and see how it responds in terms of safety, in terms of human tone, and it not being robotic, in terms of insightfulness, right? And that's how we've been able to achieve a safe flow, even as it's, more empathetic, and it doesn't, sound all that robotic. Yeah.
Yeah, so basically you've trained like multiple AI models, each one
Yes.
for a different, because then they're
Different
trained
purposes.
for that,
Yeah.
yeah, for that part of the equation. And basically
Yes.
the training happens, I guess, with maybe you get therapists or psychiatrists to
Yes.
train the model,
Yes.
right? By giving you cases and seeing if the
Yes.
model responds well to these cases.
Absolutely. Absolutely. So, in fact, we have several product managers, but 50% of our product managers are actually mental health professionals, you know, who actually then developed a knack for product and understood more about the product side, right? And then you, of course, have the tech product managers too. That's how we ensure that the responses are, we follow like a responsible AI philosophy, right? And that's followed in letter and spirit through PMs that are actually trained mental health professionals, right? So each and every aspect is looked at. We have a bi-weekly updation of data sets. There's also an LLM as a judge that highlights the wrong responses, and we have gotten very few of those now since we started working on it through progressive improvements. And that's what therapists look at, and you know they revise the data sets accordingly, and we make changes in the flow as well if they are necessary.
Excellent. Yeah, so basically, because people don't know is actually that the models train themselves. So basically, it becomes better as you use it more frequently and as
Yes,
patients use it more
yes,
frequently.
it
So
does. Yeah,
just like
yeah,
us, like if you're doing a procedure, if you're a doctor doing a procedure, the
yeah.
first 5 times you're going to cause complications. After that, you're going to be fine afterwards. So,
Precisely.
so then you got your patients and you're trying to match them to therapists or psychiatrists. But not everybody, I guess, is matched, right? There's
Not
a
everybody is matched.
flow,
Yeah.
and it says, all right, now it's time to match this person to a therapist or
Yes.
psychiatrist. How does it match?
Yes.
How does it do that?
So initially, we were focused more on demographics and the topic itself. Like, let's say I'm talking about relationship problems. I would try to match you with somebody who has an expertise in that problem. And even in relationship coaches, they are like specialists in dating. Then there are people who, specialize in specific cases, marriage counselors and so on and so forth. Right. So there's so many categories. So us at the back end, we try to categorize and figure out like the persona of the therapist. And the other thing that we found, especially in context of the cases that we saw here in our platform, was that there are a few indicators that suggest that the match is good, and more often than not, we gravitate towards people who are similar in terms of values, in terms of persona, right? When it comes to, matching somebody in a therapeutic way, right? So it helps if the therapist and the patient are similar. So we did like a personality based matching system. We tried it out. We tried to vet it, and it performed reasonably well, right? And so we were like, why not? So when we do match people now, one of course is the risk profile. We tend to match people when they come in with cases that does require human intervention, or when a patient themselves requests it, or if they're going in circles about a problem and they're not able to resolve it, even if it's a mild issue, right? And more importantly, when we match, we try to ensure not just the demographic factors like where you are from, the gender, or the aspects which usually sometimes patients prefer, but also aspects like, personality factors, which ensure that there's a, vibe match, for quote unquote, for the lack of better, just, an oversimplification. But yeah, essentially that.
Yeah, so that's what I'm going to ask you about, like even cultural matching, maybe, right?
Even
Like somebody
cultural
speaks the same
matching, yeah,
language,
cultural
or
matching.
yep, yep,
Language, yeah, exactly. Where you're from, all of that matters. But that's easier part, right? That's more seen, that's more objective. But personality type is objective, of course. There are personality, the tests to actually ascertain your personality. But doing that while talking to AI, like there's a certain amount of subjectivity involved. That said, the payoff is much, much better because once we match people to the right therapist, we find that more often than not, people end up sticking to the same one. So that tells us that we're doing something right.
exactly, exactly. And and the question I have for you is what safeguards are in place to prevent like misdiagnosis or inappropriate recommendations by the model?
Yes, yes. So we don't clinically diagnose anybody. Our purpose is to understand what is the risk, which is a form of triaging, I suppose. But we're sure to not give people any clinical diagnosis like based on DSM-5. The idea is that only a mental health professional, that to a licensed mental health professional, can diagnose and also prescribe any change of medication or medication in the first place, right? So that's what we ensure. And hence, because we are not diagnosing, our focus is just to appropriately figure out how risky is this case, right? Which, of course, is something that we have progressively achieved. We've achieved a high level of accuracy in by virtue of like constantly using and reinforcing the learning in our classification models, constantly vetting it, having like an independent board actually vet it and approve it. So all of those things actually help the entire process.
Yeah, and I guess because yeah, exactly you don't get a diagnosis, but if somebody presents to you with like, all right, I'm against the AI model, I'm saying I have anxiety for public speaking, like
Yeah.
the AI model would give him some recommendations, right? Or her. It would say, for example, go exercise or whatever, or does
It
it do
it
that?
will, it will.
It will.
So I look at it this way that there are certain things that don't violate the harm principle, right? Like for example, for most people, I mean, I'm not talking about everybody. Meditation does not work with people who have CPTSD, for example. But there are certain forms of meditation that might work well for people who have, chronic PTSD, right? So we are sure to like ensure that it's not violating the harm principle. Like what is safe, what is something that people can do on their own, right? And that's one of our conditions, that we only recommend things that people can safely do and execute on their own without significant possibility of any complication or any kind of people getting re-traumatized, so that sort of a thing.
Exactly, such as like exercise, diet, meditation,
Yeah,
like
yeah,
that.
yeah, things that are universally considered to be good and also for that condition like not contraindicated.
Right.
Yeah.
And talk to somebody about it. And have you seen what are some of the concerns about? Because some people might say, you know what, I'm concerned about my privacy and like sensitive mental health data that I have. How do you alleviate these concerns?
Yes, it's a very valid concern, and India is less bothered about privacy, but I know US is, and that's why one of the first few things that we did, since we had a lot of users coming in from United States, was to become HIPAA compliant, and we did that in the initial few months, as soon as we saw a lot of US users actually coming on our platform, and now we've done that for like we've tried to be compliant with GDPR, with local regulations in India, of course, like DPDP Act and so on and so forth. So we have just one person dedicated. Like we recently hired a person just to look at what are the regulations that are coming up, what's happening. Like, is there some state law that we are unintentionally not following? And yeah, like just geofencing and figuring things out really quickly because you've got to adapt, right? So yeah, that's the
Exactly.
whole idea.
Exactly. And now that we've talked about like the concerns and stuff like that, what about because you've been out for a while now, and what has been your impact? Have you seen measurable improvements, I guess, in access,
Yes.
engagement, or outcomes?
Absolutely. So we've been around for almost 1.5 years. We launched in October of 2024. And since then, we have a variety of ways in which we try to collect some kind of feedback through a variety of touch points. We, of course, have the conventional, in-app surveys that gauge output, that gauge whether this helped you or not, or, also, a way to actually track complaints from the user. So we of course have that, and that showed that 91% of the people who actually use the platform found it helpful either in symptom alleviation or in actually improvement of mood or it actually helped them develop psychological insight, right? And additionally, we have been also trying to do some kind of clinical studies by partnering with academic institutions. So there's one such in India called NEPET Sikandrabad. So we actually partnered with them. We had like a trial for 8 weeks, and we had 600, close to 600 participants, and we tried to see the impact of the product in the experimental and the control groups, right? And we of course went ahead with the whole exercise, and that told us that it does have a statistically significant improvement. Like you see a statistically significant improvement on the FAM call scale in the in the experimental group versus the control group, right? And then now what we're trying to do is more of a longitudinal study, because I know that AI as a tool is tremendously useful in the short term. Like if I'm using it for when I'm in acute distress, it does tell me like good suggestions that I can follow. But what about its impact over a year or maybe 2 years, right? So it's important to actually study that in specific cohorts. But these studies are somewhat expensive because you need to have people who stick around that long, you know. So that's something that we're also attempting, and it'll be one of its kind studies that we hopefully intend to have in a year's time. Yeah.
Yeah, and one thing I'm thinking about if we measured it is because people have lack of access, right, to mental health
Yeah.
professionals.
Yeah.
So, are you able now with with your platform to screen patients who are milder and not have them take the spots of patients who are more severe, I guess, when they're seeing it? So that way, you
Yes.
decrease the waiting time for mental health professionals.
Absolutely. So what we are solving for is, of course, access, right?
Yes.
And as a theoretical concept and as something that we've seen in practice, it's working wonderfully. But when we talk about somebody taking somebody else's slot, it's usually in context of public health systems and in context of like insurance or free systems, where things are free effectively for the user, right? So that is something that we recently started working on. I mean, when you're working as an independent entity, I don't look at it as okay, this person saved the time of X person, right? Because in my system is finite, and I consider that the system beyond my system is has a lot more therapists. So even if for whatever reason, I'm saving people from going to, like, I'm saving the time of this person, people can still access, right? It's an infinite, relatively infinite system, right? But in public systems, it becomes more apparent because these are huge systems, and here you really can see that effect more effectively, where let's say people come in with a relatively, I wouldn't say trivial, but I would say that relatively a milder situation, which can be resolved more readily by a combination of AI and maybe taking a therapy a few times a month, to something which is more severe, which warrants like a host of actions, and more, I would say, concerted efforts at taking therapy, maybe every week, maybe twice a week, right? So that's where it becomes more apparent, and you would love the possibility of working with large public health ecosystems where we can actually see this in action more readily.
Right. Because what you're saying is like systems like in the UK, right? NHS,
Yes,
or
NHS. Yeah,
Canada,
yeah, yeah,
or some of the other
yeah,
countries
yeah,
that have large public
yeah,
health
yeah.
systems. That'd be
Exactly,
interesting.
exactly.
Exactly.
Yeah.
Exactly. And do you have any specific stories or examples where your platform made a significant difference? I mean, I'm sure you
Oh,
can't say
absolutely.
patient
Yeah,
names or anything like that, but yeah.
yeah. Yeah, no, absolutely. I think I mean, we of course focused on, mild. 85% of our cases are what I would call mild or life challenges or people, trying to know themselves better. So we found a lot of good stories in there where people have actually managed to, call out a loved one who are, and like just experiencing a whole lot of catharsis. We've actually had people, essentially being able to sort of relax and come out of survival mode after a while, because, getting their thoughts out and following some of the steps recommended by our AI were helpful to them. But I think more rewarding has been seeing people who come in and who are also taking therapy parallelly, like people coming in with OCPD, and people actually coming in with, even moderate instance of depression, right? And them being able to like get out of bed, or them being able to actually take the first step towards getting out of a very dark place, right? And them saying that, therapy is great, but this is also something that gave a lot of insight. And The best part is that that insight is actually something that came from me, right? Like I basically was able to unravel my own thoughts and I was able to see my own patterns. That, of course, is very rewarding because there's a sense of empowerment in that. When you actually sit down and you put all your thoughts down and you're able to see how they all connect and how actually a lot of problems can be resolved by just accepting things and by actually willing to change, like parallelly. Like I think Carl Rogers once said that the curious paradox is only when I accept myself can I change. I think it's also the other way around. Like the only sometimes you find it easier to accept yourself and the things that are wrong about you if you actually take the first step, right? And I think that somewhere down the line when people see both these things happen in tandem, that I think it brings a very monumental shift in some people, and that's really encouraging and heartening.
Right? It's basically taking the first step,
First
and
step,
and
yeah.
then that helps you get out of the vicious cycle that you're in,
Yes,
I
yes,
guess.
yeah,
And you are in
yes,
165 countries, so you're probably in high income, low middle income, and low
yeah,
income countries.
yeah.
How does your platform help underserved populations or regions with limited access to care?
Yeah, yeah, yeah. It's very heartening to see it being used in Latin America, parts of Latin America, and also parts of India that are extremely underserved, where there are no access to therapists at all. So there, it's not even a debate that whether, should you be going to an AI for help. I mean, you have no other option, literally, right? So when it reaches that cohort, I find that specific cohort tends to appreciate it a lot more because obviously they don't have anything, and there are less concerns around like sometimes we get very theoretical as people who have been working in healthcare, and we just don't want to err on side of caution, right? We just don't want to make mistakes. So even if that stops us from doing the right thing, we would just rather not do the right thing and have the possibility of making a mistake, right? In those populations, however, that so-called ethical dilemma that a lot of us struggle with when we are building for anything healthcare is actually to quite an extent allayed, because here you see that, okay, had this not been around, the person would have had access to nothing and they would have probably carried on with their life as is, right? So that's what you've seen, in these, like I would say, lower income countries or the more developing parts of the world.
Yep, that's great, and yeah, and at least you give them access to at
Yes,
least some mental health services and potentially even to mental health specialists, maybe at a cheaper rate
exactly. If
eventually.
they, yeah, if they, yeah, absolutely, absolutely. That's the goal.
So, do you see AI companions replacing any part of traditional therapy or only augmenting it? Because people are scared, right? Like you're like the pathologist
People are
saying they're going to
scared.
replace my pathology, the radiologist is going to say AI is going to replace me. What about mental health specialists?
I don't think they can replace the good old doctors or therapists of the world. I think they'll be used to augment capacity after the initial hype phase that every technology brings with it, where technology seems omnipotent and capable of solving everything. We soon realize the limitations, right? So that phase will soon come. We will realize what AI is capable of and what it isn't. And I can say for myself that AI is actually a great tool to augment human capacity, right? And on its own, AI can't provide some of the therapeutic value that we get through human interaction. Like when I'm talking to you, you're also your nervous system is co-regulating me almost, right? If you're grounded yourself. That's not something that AI can do. AI can just use words. It can just sound empathetic, right? That said, a lot of times our problem is not that we don't have empathy. The problem is that we don't understand ourselves. And when you put your thoughts out, you're able to sort of understand yourself and accept yourself better, right? And that's where it can be helpful. So I look at AI as just, a way to mirror or really help you understand yourself better. That's where I look at AI being helpful. But the relational part, I think, hands down, will always remain relevant, irrespective of what modality we speak about, irrespective of, which domain in medicine, really.
Right, because humans are social beings, I guess, and you always want to
As social
interact with
beings. Yeah,
someone.
yeah, yeah.
Yeah,
Absolutely.
but I get what you mean too when you are able to relay your thoughts to someone, even AI, that'll help you
Yeah.
be able
It's
to figure
cathartic.
out what's
Yeah,
wrong with you and try to solve it.
precisely, precisely.
And so a couple of rapid firing questions now as we approach the end
Sure.
of the podcast. So, what is one myth about AI and mental health that you want to debunk?
It's not really a myth. I would just want people to get out of this whole like AI versus human debate. I would like to think of it this way that AI can help augment human capacity. We need to build systems that put humans at the forefront, but AI is actually a tool to, bring scale, to essentially solve some of the repetitive and I would say things that can be solved through AI are, just information. AI does disseminate information really well. AI is great at pattern recognition. So these are the tools that can be actually used by clinicians also to make their practice more efficient, right? If they embrace AI and if they are able to sort of understand its potential in that sense. Yeah, I think just that, like just, embracing change and then regulating it. I mean, I'm big on regulation. A lot of times as technologists and also people working in healthcare, we would rush to claim that we've solved a problem in entirety. That's often not the case. So you need regulation to delimit and to figure out the boundary conditions. What is an absolute no, what is an absolute yes. Yeah.
Right. What you're saying is countries need to have, each country needs to have, or even maybe worldwide regulations on
Worldwide
the adaptation
regulations,
of
yeah, for
AI
sure.
to protect to protect data, right? To protect people's
Absolutely.
privacy, safety, stuff like that. So these are regulations that are needed.
Absolutely. Absolutely.
What is the biggest risk if we don't adopt AI in mental health?
I think AI will transform every industry, right? Whether we like it or not. And this is not essentially in our hands at this point of time, right? I mean, we didn't ask for Chat GPT, like we didn't ask for AI mental health to become so big as a use case. I mean, Harvard Business Review says that therapy and companionship is the number one use case on large language model that in the year of 2025, right? And I just think that, if we don't embrace it, I don't think AI will take away jobs, but I think people who know how to leverage AI, they might be able to bring more scale or to bring more efficiency, which in some way can, put them in a better place than people who don't, right? But ultimately, it's about skill, right? Nobody can take away your skill, and there's value in human judgment. There's value in intuition. There is value in, empathy and intention, right? And that I think cannot be taken away by any AI.
By an AI bot, exactly. And so one, which brings me to the next question, which is relevant now, is one piece of advice you would give for clinicians or mental health specialists navigating this AI wave.
I don't know what to say really. Like, I think it's just about certain degree of openness and a certain degree of like willingness to learn. I know that this is not something that mental health professionals or health professionals like to hear a lot because they're constantly learning, right? And how much can you learn when you're still practicing, when you're still going about your day, right? Like, there are limits to what a human being can possibly do, and you've already done a lot. Really, but when you get the opportunity, right, it makes sense to sort of be open, try to see the potential that it can bring. Really, also, be active in your communities. Try to push for regulation, good regulation that can help everybody involved, that can help us as tech companies. Also, because absence of regulation is the worst thing for a startup. You're always feeling so uncertain about things, right? So yeah, just I think working together to really figure out how this particular thing, how AI can actually be leveraged in your domain, right? More dialogue on that could also be a starting point, right? Which all of us can partake in, perhaps. So just that, like openness and dialogue is
I agree.
what
I,
I
and
believe should be a
I think,
starting point.
yeah, you said like a certain number of hours a day, but at the same time, maybe AI can actually help you do
Precisely.
more in less hours. So it'll help you even like
Yes,
be more efficient in terms of what you do.
absolutely, absolutely. Yeah,
And
definitely. It can help you with efficiency. Yeah.
final thought, can AI truly transform human emotion?
Yes, in some ways, yes. I've seen it as somebody who has built a product for themselves and who has been using their own product for a while. I can say that I feel a lot better. And maybe the magic is not AI necessarily. AI is just a tool to know yourself. Maybe the magic is within you, right? And the right AI tool is built in such a way that empowers you, that makes you realize, your own capacity to heal yourself, to understand yourself, and to self-regulate. So I think the magic is you. So I think in that sense, yes, AI can transform human emotion.
Rishi, thank you for being on the podcast and for the great actually AI platform that you have developed,
Thank you so much.
Healo.ai, right? Healo
Yes,
dot
it's
AI that is
Hero AI.
currently Healo AI, and it's currently in 165 countries around the world. So most countries, I guess, have
Most
adopted
countries.
the
Yeah.
platform. All right, thank you very much.
Thank you so much. It was wonderful talking to you, Khalil.
Thank you.
Thank you.